In the spring of 2020, New York City, one of the world's most vibrant and densely populated urban centers, suddenly found itself at the heart of a global catastrophe. The city, famous for its energy and constant motion, was brought to a near halt as the novel coronavirus swept through its boroughs. The pandemic's arrival was swift and merciless, catching millions off guard and transforming daily life in ways no one could have imagined. The novel coronavirus, later known as COVID-19, spread with terrifying speed and lethality. Hospitals quickly filled with patients struggling to breathe, while doctors and nurses worked around the clock, often with limited supplies and little rest. On the streets, masked pedestrians moved cautiously, if at all, as the city's usual hustle faded into an anxious silence. The sense of uncertainty was palpable, and the fear of the unknown weighed heavily on everyone. Ambulance sirens became the city's unrelenting soundtrack, echoing through empty avenues day and night. Each wailing siren was a stark reminder of the mounting human toll, and for many, the sound became synonymous with loss and anxiety. The city that never slept was now haunted by the constant presence of emergency vehicles, their lights flashing against the darkened skyline. Hospitals were overwhelmed beyond capacity, with hallways and waiting rooms transformed into makeshift treatment areas. Temporary morgues appeared outside medical centers, a grim testament to the scale of the crisis. Healthcare workers, clad in layers of protective gear, became the city's frontline heroes, risking their own health to care for the sick and comfort the dying. The emotional and physical toll on these workers was immense, as they faced an unending stream of patients and heartbreaking losses. In the midst of chaos, Governor Andrew Cuomo's daily briefings became a lifeline for many New Yorkers. His updates provided not only crucial information about the evolving crisis, but also a sense of structure and reassurance during a time of deep uncertainty. For countless residents, tuning into these briefings became a daily ritual, a way to stay connected and informed, even as the world outside felt increasingly unpredictable. The primary goal was clear: flatten the curve. This meant slowing the virus's transmission to prevent the healthcare system from collapsing under the weight of new cases. Public health officials and medical staff worked tirelessly to prepare for the surge, urging everyone to do their part by staying home and following safety guidelines. The message was simple, but the stakes could not have been higher. To achieve this, the state implemented drastic and unprecedented measures. Businesses, from bustling restaurants to iconic Broadway theaters, shuttered their doors. Schools closed, forcing students and teachers to adapt to remote learning almost overnight. Subway platforms, once packed with commuters, stood eerily empty. The rhythms of daily life were upended, and New Yorkers were ordered to stay home, venturing out only for essentials. The vibrant metropolis was brought to a standstill, its streets and parks deserted, as millions waited in isolation for the storm to pass. The city's legendary energy was replaced by an uneasy stillness, as New Yorkers faced the greatest public health crisis in generations, united by hope, resilience, and the determination to endure. The sweeping lockdowns were justified by the science of epidemiology, as understood in those chaotic early months. Public health experts advised that limiting close contact was the most effective strategy. Cuomo's administration enacted policies mandating social distancing, closing non-essential businesses, and restricting gatherings. The goal? Break the chain of infection and give hospitals a fighting chance. By fall 2020, the approach shifted to the Cluster Action Initiative, targeting specific neighborhoods with high transmission rates. These areas were color-coded, with red zones facing the most severe restrictions, including business closures and strict limits on worship. This data-driven approach aimed to combat the virus without shutting down the entire state. For New York's Orthodox and Hasidic Jewish communities, the lockdowns, and especially the Cluster Initiative, felt like a direct assault on their way of life. Communal prayer, religious study, and shared traditions are central to these communities. Restrictions on gatherings struck at the heart of religious observance. A minyan cannot be achieved over Zoom. Synagogues, the hubs of community life, were closed or severely limited, causing spiritual suffocation. Weddings, funerals, and the high holy days were disrupted, forcing impossible choices between state orders and sacred obligations. The closure of yeshivas further disrupted the core tenet of Torah study. The response from the affected Jewish communities was swift and forceful. In neighborhoods like Borough Park, protests erupted, with thousands voicing opposition to the lockdowns. Masks were burned in symbolic acts of rebellion, and law enforcement faced hostility. These protests were fueled by frustration and a sense that fundamental rights and religious freedoms were under attack. Community leaders argued the state was engaging in collective punishment and ignoring efforts to comply. Figures like Heshi Tischler became prominent voices of resistance, openly defying orders. The protests revealed a deep chasm of distrust between the community and the state. As tensions peaked in the fall of 2020, Governor Andrew Cuomo found himself at the center of a storm. The COVID-19 pandemic had upended life across New York, and the governor's decisions were under intense scrutiny from all sides. With emotions running high, Cuomo remained unapologetic, standing firm in the face of mounting criticism from religious communities, business owners, and even some public health experts. When pressed by reporters about whether he would apologize for the pain and hardship caused by the state's strict lockdowns, Cuomo's response was blunt and unwavering. He said no, making it clear that he believed his actions were justified, even if they were unpopular. He defended his decisions as essential to save lives, pointing to data and infection rates as evidence that the measures were working. Cuomo argued that the restrictions, though difficult, were necessary to prevent hospitals from being overwhelmed and to protect the most vulnerable New Yorkers. Despite the outcry, he refused to admit flaws in his public health strategy. Instead, he doubled down, insisting that every decision was made with the best available information and with the goal of saving as many lives as possible. Cuomo did, however, express regret for the disruption his policies had caused in people's lives. He acknowledged the pain and frustration felt by many, especially within New York's tight-knit religious communities. In his words, "I am sorry that they feel the disruption," a statement that seemed to offer sympathy, but stopped short of taking responsibility for the consequences of his orders. He specifically mentioned the disruption of religious ceremonies, acknowledging that many families were unable to gather for worship or celebrate important milestones due to the restrictions. The closure of schools, particularly those serving Orthodox Jewish communities, was another source of deep frustration. Parents and students alike struggled with the sudden shift to remote learning and the loss of daily routines. "I am sorry for that," Cuomo said, his tone somber but resolute. Yet, for many, these words rang hollow. Analysts noted that this was a carefully worded statement, one that expressed sympathy for the impact of the policies, but carefully avoided any admission of fault or error in judgment. There was a clear distinction between feeling sorry for the disruption and accepting responsibility for the decisions that caused it. For critics, especially within the Jewish community, Cuomo's stance felt dismissive and insufficient. Many believed that a true apology would have included an acknowledgement of the pain caused and a willingness to listen to those affected. The lack of a full apology only deepened the community's sense of alienation and mistrust towards state leadership, fueling ongoing protests and calls for greater sensitivity to religious needs. In the end, Governor Cuomo's stance became a powerful symbol of the broader conflict between public health imperatives and the preservation of religious freedom, a debate that would continue to shape New York's response to the pandemic long after the press conferences ended. 5 years later, on October 1, 2025, the political landscape in New York had changed dramatically. The city, always in motion, was now colored by a new sense of reflection and accountability. The air was crisp, leaves turning, and the city's energy felt different, more contemplative, as if the past was finally catching up with its leaders. Andrew Cuomo, once known for his unwavering confidence and combative style, now appeared more subdued. His tone, which had often been defensive and unyielding, had softened noticeably. In a move that caught many by surprise, the former governor released a heartfelt video apology addressed specifically to the Jewish community of New York. The video was shared widely on social media and quickly became a topic of conversation across the city. The timing of the apology was no coincidence. It came just before Yom Kippur, the holiest day in the Jewish calendar, a day dedicated to atonement, reflection, and seeking forgiveness. For many, this added a layer of gravity and sincerity to Cuomo's message. In the video, Cuomo openly acknowledged the pain and distress that his administration's pandemic-era policies had caused to the Jewish community, particularly regarding restrictions on religious gatherings. This was a direct and unambiguous admission, something he had carefully avoided during the height of the crisis in 2020. Back then, Cuomo had sidestepped questions and maintained a firm stance, rarely conceding any fault. But now, his words carried a different weight, as if shaped by years of hindsight and public scrutiny. He explained, "While our decisions were always intended to protect public health and save lives, I recognize that we did not always fully consider the sensitivities, beliefs, and traditions that are so deeply important to the Jewish community." Cuomo went on to say that he now understood how these actions, though well-intentioned, had unintended consequences that deeply affected families and communities during sacred times. He expressed a desire to learn from these mistakes and to do better in the future. With visible emotion, he conceded, "We could have done better, and for that, I am truly sorry." His words seemed to resonate with many who had long waited for such an acknowledgement. Cuomo's message marked a striking departure from his earlier defiance, signaling not just a personal reckoning, but a broader shift in how leaders confront the past and seek forgiveness in the public eye. The reaction to Cuomo's Yom Kippur apology was as complex as the community itself. For some, it was a welcome and long-overdue gesture, a moment of validation after years of feeling dismissed. They accepted the apology in the spirit of Yom Kippur, ready to move forward. Others met it with deep skepticism, viewing the timing as a calculated political move. Cuomo was in the midst of a tough mayoral campaign, and many questioned his sincerity. The memory of 2020's defiance and legal battles lingered, making forgiveness difficult. The apology became a new flashpoint in the ongoing relationship between the community and the state. Cuomo's 2025 apology can't be separated from the political context. After resigning as governor in 2021, he launched a comeback, running for mayor of New York City as an independent. Having lost the Democratic primary to Zohran Mamdani, Cuomo needed to build a broad coalition. The Orthodox Jewish community, once alienated, became a key target for outreach. The apology was a direct effort to rebuild that bridge. Mamdani's progressive stance and controversial statements alarmed many Orthodox leaders, creating an opening for Cuomo. Several influential Orthodox groups endorsed Cuomo, citing fears over Mamdani's policies. The conflict between Cuomo's administration and New York's Jewish communities offers a lasting lesson about balancing public health and religious freedom. The COVID-19 experience showed that a purely clinical approach can have devastating consequences if it ignores deeply held beliefs. True public health must consider spiritual and communal needs, not just physical safety. Communication and cultural competency are critical in governance. A better path would have involved genuine engagement with community leaders as partners, not subjects. Accommodating religious practice safely could have fostered cooperation and better outcomes.